So, hello friends, welcome. This is Aruna Patki, and today we have a very beautiful case to share with you all. This is something new. It's not new to Ayurveda, but it is new to our surroundings, and this condition is called as urticaria. Urticaria is known as Shita Pitta in Ayurveda, and Shita Pitta is a condition, skin condition, where we see the raised papules, where we don't see a pus into it, but we see the papules raised on the skin. So we have a client who was suffering with this skin condition, and for maybe from January. So she's suffering with this skin condition, urticaria, from January 2021. That means almost like a 3.5 months or 3 months almost. And she came to Ayurveda and see what happened with her, and how just with some of the body work what she chose, how it helped her, and as per her, she says it's like 100%. Instead of me telling, why don't we hear from her what she's feeling, how she's doing, and what are the changes she's going to follow with this condition, and how she came, and what exactly is happening, and what are the changes she's going to make sure that she's supposed not to do during this cleansing, during this skin disorder condition. Because in Ayurveda there are certain things which are mentioned to avoid during the skin diseases. So let's hear from her. I will just turn on the camera towards her. Give me a second. Let me see if I am doing properly. Here she is, and we would like to hear from you. So if you can share how exactly how you are feeling, and what you are feeling, and how you are doing, and what you want to do along with it. Because friends, these are certain things we are going to talk about, certain things. So do you remember what it is?
This is rose petals.
Yes, petals, rose petals, yes. And we are going to eat that. Empty stomach. You already tested it. What is that?
Yes, this is the massage oil.
And how are you going to use it?
Warm it, maybe 2 tablespoons, and warm it, and apply it to my skin after bath and shower when my skin is still damp, and particularly to the areas that are affected.
Yes. And what is this?
What is the
the application on the skin.
Yes,
with the soda bag.
Is to mix with baking soda and to mix with oat flour and apply it to the areas of inflammation and allow it to dry to cool down the skin. Right.
All right, and then we have this one.
Yes. This is an herbal ghee to apply to my skin at night and to sleep with it so that it penetrates the layers of the skin to cool down any inflammation that may happen.
Absolutely. So now just tell, when you came in, what was your feeling, and when with the bodywork therapy, which you chose, it's called it as what?
The poultice.
Poultices.
Yes.
That was your favorite one, right?
Yes.
So what happened with it? When you can show where you had that kind of things on your skin.
And will you maybe post the pictures?
I can post it,
pustules? Yes. With my skin, it felt as though there was electricity under the skin, and it would cause it to flare up. It looked like
raised
a pickle. My arm looked like a pickle with the bumps, but they were larger. They would come out of nowhere. There was no thing that I did to make it happen, and there was nothing that I could do to make it go away. The episodes would last maybe 15 or 20 minutes at a time. I've had this condition since January, and it started with just a simple itch in the palm of my left hand, and eventually it went all over my body. I did not go to the hospital until maybe 3 weeks ago, when I had an attack in my knees and my legs swole, and that attack lasted for more than an hour. So I was in pain, burning, itching, and the more I scratched, it just left ligatures like octopus on my arm, just red. I would rub it. Initially, I would scratch it, and that made it worse. So I started to rub it. It didn't. It just. I knew that there was something in my blood. That's what it felt like. I've gone to my conventional doctors, and they've taken blood tests after blood tests, and everything comes back normal. When they take the blood test, they write prescriptions for antihistamines and for body cream, even before they get the results back from the blood test. And I said, I'm not taking this. We don't know what's wrong. So how can you give me medicine when we're still waiting for the results to come back? And at that point, when the final blood came back and they said everything is normal, I said, now it's time to call Dr. Patki. Because the poultice treatment that I chose was one to help unblock my channels, but also to bring relief to my skin and take out the inflammation, and also just to relax my mind. And the healing touch relaxed my skin. And I was able to, while we were having it, there was some music on, and I just started to do the chant, the each time to let the breath out.
We did some mantras.
And I could feel the heat coming out even in my breath. After my treatment, I was able to go home, and I got ready for bed, and I just slept through the night for the first time without my skin feeling tight, without it burning, without waking up and scratching and trying to find something in my house to make it stop. Since then, my skin is clear. I have not had a breakout. I'm being careful not to put a lot in my body, because even after the poultice, I feel like my body is still trying to cleanse and trying to regain its strength. So I'm having a clear diet. And then during the evening, if I eat, it's at 4 o'clock, so it's not too late to allow my body to digest. And it's been 2 days, so that's what I'm practicing right now. And now I have my oils, my teas, my ghee, my supplements, and I'll just continue with that. And then in 2 weeks, I will schedule for a detox therapy to come in for 3 days in a row to keep this going. But it's made a definite improvement. Conventional medicine is about giving you more medicine before determining what the cause is. So that's my experience so far. But it has been, I knew this was the right place to come, and that we would discuss it, and we would both agree that it's something in the blood that we need to get out.
This is called as Shita Pitta in Ayurveda, as I told you, right? So Shita is like a cold, like a Shita means cold, or the water element. Just imagine, or the earth element, or the third dosha in the body. You know, remember the kapha in your body.
Yes.
And Pitta Shita Pitta means, Pitta is when the cold air comes in contact with this location, the pitta, that is where it gets like a kind of bringing this raised patches on your skin. So Shita Pitta, this disease urticaria, is very much it's like a imbalance between your kapha, which is where you are getting a lot of itching sensation, and aggravation of kapha and vata. Aggravation of vata. So we got aggravation of kapha, we got aggravation of vata. It occurs when it come in contact with the cold air. So check it out if you have too much cold air in the house, too much cold air wherever you are going, and maybe the weather around you. Check it out whether you have excessive coolness around you.
And I do notice that when the cooler and the fan is on,
it starts
exactly. To raise the bumps.
Because what happens is, like, because of this, all of these things, the pitta gets also aggravated in the body. So pitta aggravation, when pitta is aggravated, the pitta and the blood the Rakta Dhatu, they have deep connection, interconnection in the body in Ayurveda. So your Pitta, your one of the three dosha, and your blood is another fourth dosha actually, but we do not talk here in this country because it's a very huge concept to talk about, but that's what we learned in school. And the father of surgery, which is Sushruta, he has mentioned blood as the fourth dosha in the body. But in America or in the Western world, we mostly talk about Vata, Pitta, Kapha, and we do not talk about blood tissue as a fourth tissue, fourth dosha in the body. So that's the reason in Ayurveda we consider blood as one of the primary thing to follow.
Yeah.
Okay, so this is how the whole disease concept comes in. So aggravation of Pitta, aggravation of Kapha, and aggravation of Vata. So now you tell me, how many doshas are aggravated?
All of them.
All of them are like out of balance, And these aggravated doshas, when this Pitta connects with the blood tissue or blood in the body, blood dhatu, which is like Rakta Dhatu. Rakta Dhatu means, Rakta means blood, Dhatu means tissue. So when it mixes with the Rakta Dhatu, it travels throughout the body along with the blood, because that's where it is mixed with, right? And it goes and stays relocates in the body wherever there is a weak point, specifically in the skin.
In the joints.
In the joints.
Yeah.
Okay. And this is the cause of urticaria in Ayurveda. So we need to think about three doshas. And what is the fourth dosha?
Or blood.
You got it.
Yes.
That much importance Ayurveda has given. In surgery, the godfather of surgery, which is one of the acharyas, Sushruta, has mentioned blood tissue as a fourth dosha in the body.
And I knew that there was something in my blood. It's nothing external. It was something not in my diet, because we could not pinpoint anything in my diet. No nuts, no shellfish, none of those things. My body, my blood needs to be cleansed. And that's what I knew after all the tests kept coming back saying your blood is fine. My blood is not fine. But to Western medicine, the things that they look for are not there.
That's where some of the Ayurvedic things, the diet change, that is going to play a very important role for you. So as we talked about diet changes, lifestyle changes, you are going to do it by heart. No smoking, no drinking, please. And specifically stay away from fish.
Absolutely.
Please.
Absolutely.
Please. Fish is not really a good food in the skin conditions and skin disorders in Ayurveda. That is the low cost food. That kind of that kind of eyes will look towards the fish. It's not really a healthy food for the skin diseases in Ayurvedic literature. There is a term. It means like very low kind of food for the healing purpose. Fish. So it says big no to the fish and ocean creatures.
And the ocean is not clean.
Because our ocean is changing so drastically. So we do not recommend in Ayurveda that fish is a good choice. Not at all. Okay? So make sure we will follow this. And the herbs, what we are talking here, this curcumin. Curcumin is we use curcumin in everything, but here as we do not know the reason of curcumin, as we do not know the reason of your things and why it is happening to you and what is the problem, we are using this tricurmin, which is a strong extraction of turmeric. It has a beautiful tricurmin in it, which is a very potent one compared to the regular turmeric. So we are going to use this as a good I don't care about managing the pitta in the body. So let's think about that way. we will be using the strong tricurmin to manage our pitta dosha and to manage our blood tissue health in the body. Okay, and then we have neem. Neem is like a Azacardia indica. That's the Latin name of the neem. Neem is a good herb. It is a Ayurvedic herb where we use it for the skin conditions, specifically in Ayurveda, because it's a cleanser for the blood. It's a blood purifier.
That's what I need.
Okay, blood purifier. And the moment you came on that day, and then I said, like, show me your picture. By looking at your picture, I got to know, okay, this is what she has it, you know. Because when you see so many clients and when you know, like, okay, but pictures talks a lot.
Sure.
And because these are the things that comes and goes. It's not like constant. It stays under your skin like psoriasis or like, you know, the lichen planus or some of the skin conditions. They're on the skin and it's visible all the time. But urticaria is not like that. Urticaria is very specific. Shita pitta, it's a very specific disease. So you need to understand the Shita Pitta or the urticaria, how it's not like 24-hour skin visible thing. It is like comes and goes, you know, on its own. So you cannot even control this problem. You know, you can't, if you want to show someone, there is nothing on your skin, but the client suffers, the person suffers with this condition, you know. So neem we are going to use to our client, and I have prepared such a wonderful combinations of oil and ghees and pastes and applications, which I'm going to share with you all very soon. So another cleanser for us, a blood cleanser for our blood tissue. Not only a cleanser, but to enhance the condition of our skin health, we will use this. Okay? Cleansing is one purpose, but again, toning the skin is also a very important factor in Ayurveda, you know? So we'll use it for the healthy skin approach also. And then another thing, yep. Yeah. So we have, I'm using some Google concept. How many of you know the Google concept? Do you know what is Google in Ayurveda? So as she has a tremendous itching, like the way she told me, what did you just say like a few minutes back when I asked you, what is the pain level? Oh, labor pain. Like so, you know, sorry. She's so funny. She said like the skin pain, the condition on her skin joints, and the condition in the joint, the pain, it reminds her about the labor pain. So can you imagine like what is the level of pain threshold or the level of pain the client has when they go through the certain diseases in the body? Exactly, this is a proof that pain during the labor. Imagine, guys, I know you will not imagine, but ladies, I know how much that pain you bear, and most of you are doctors, so you know what the patient feels in India, you know, or all around the world. But my client is feeling tremendous pain in the skin disease what she is going through. So we are using these specific herbs to get rid of some of the symptoms of her pain, what she is suffering at the present moment. At the same time, we are managing her pain level through a very beautiful Ayurvedic herb, and many of you know this. That's called it as a Triphala. You also know. My clients are very smart, you know. They know everything about Ayurveda nowadays because I make sure that they understand Ayurveda from their heart. They understand Ayurveda from their bottom of their heart and mind, you know. I want them to love to Ayurveda. I want them to take care of themselves by doing some smaller changes in their day-to-day routines and lifestyle changes and yoga poses and yoga practices and breathing practices to bring this more sattvic concept into them. You know the sattvic concept now?
The clean concept?
Yeah. See, now my clients, even if, you know, she was not at all aware of Ayurveda until few months. Now she talks more than me.
You encourage us to continue to learn about Ayurveda.
And I think I have very good students because they'll just follow and practice and do the changes with the Ayurveda very, very nicely. So, we are trying to resolve her problem here. We are trying to guide her the Ayurvedic ways of eating and Ayurvedic ways of living and Ayurvedic ways of practicing and Ayurvedic way of doing certain things on the day-to-day basis, so that she can follow this dinacharya and a ratricharya and a rutucharya all together. This is very hard. As I'm practicing in the United States, our cultural things are very different. Our ways of looking at the things are very different. Our lifestyle is very different. Our ways of living life is different, okay? And the level of pain and level of stress and level of anxiety, I can say, anxiety and depression is a very common factor for us. So it's just like taking and teaching and retraining and reshaping their thoughts and creating this awareness of Ayurveda and yoga and the clean living and peaceful living, and bringing this mind, body, and spirit concept together for their health and wellness is the only key. What I see is like working very well with my practice, and I love the way I teach my clients the simple, easy, clean way of making them aware of what they are doing to themselves. I hope this is helpful. So we are using all of these herbs, and this herb is called it as a Triphala. Triphala is a cleanser, purifier, vata balancing, all three dosha balancing herb. That's why as she has a symptoms of all the vata, pitta, kapha imbalances in her, I'm going to use one of the Triphala, and then I'm going to use the Gugul concept, which is a Keshur Gugul for her joint pain and her pain, and a little bit of concept of some weight challenge for us. So we will be using nice herbs for her, and I will be giving all of this to her for her current condition. But the most important thing what she has is this one. So I need to show you guys what I have prepared. And Ayurveda, in my practice, I do everything which is 100% customized for that person. I do not have this repeated for my next client, not at all. I do not have the practice that way. I clean, I make, I grow, I cultivate, I have my own crop, and I create my own herbs and oils for my clients from the scratch. That's why I think it works very well with my clients, and they give very beautiful results to me. So I'm very happy what I do to them and what I teach to them and the way I make them to understand all these problems. So we have this made up her local application on the skin. Then we have this for nighttime. She is going to use it on her skin. And then we have a jam in Ayurveda, which is a pitta cooling jam, which is called it as a gulkanda, made up from the fresh rose petals. How many of you know gulkanda? So this is a combination of gulkanda with the pitta shamak herbs in it, okay? And then we have the oil, which is a very specific oil for the whole body massage, as I know her stress level and as I know her other things also. So we have all of this for her, which is prepared specifically only for her. Okay, so Ayurveda is not one thing. Ayurveda is your life change. Ayurveda is your consciousness. Ayurveda is your mind, body, soul connections. And Ayurveda is not a one thing you do. Ayurveda is like you think about everything from the morning time until the bedtime. And this is where the wholeness of Ayurveda is going to come in. So we are using all of this along with certain herbs which I have here for her, and she knows it now how to take it. So we'll be using all of this for her wellness purpose, and I am wishing maybe if not wrong, she will start feeling changes maybe from right now, but I will like to get it slowly because skin takes a time, and I have done at least 1,000 hours of work on my skin clients. So I have seen 30 to 50 years of skin diseases on a 60-year-old or 70-year-old or 50-year-old. So they live their life with the skin diseases, because we do not have a lot of options except few like applications, external applications. That's where I prepare my oils and ghees for my clients. That's where we ask our clients to change, not from outside in, but inside out. Inside out change is the bringing the harmony back, bringing the balance back, bringing the all doshic balance, tissue balance. Dosha. Well, the concept of health in Ayurveda is samadosha, samagnischa, samadhatu, malakriyaha, prasanna atma indriya manaha swastha iti abhidhiyate. That means bringing the harmony back on your dosha, on your tissues level, on your waste levels of the body, and a healthy, happy soul, mind, as well as your Agni concept in the body and your sensory organs health. This is all together is a logic of your health. So here is a good, I wish you good luck. Do this, practice this. Do you still remember the diet change?
No fish.
No fish, okay. No meat, no fish, no pickles, no sugar, no vinegar, no frozen food, no pocket food, no tomatoes, no tomatoes, no microwave, no pocket food, and no staple food. Stale food, what do you call it? Stale food? Stale food. Old food. No old food.
No alcohol, no smoking, all the other stuff that
no
we
smoking,
know.
no alcohol, no pots, nothing. Okay?
Yeah.
Anything else I'm missing with you?
No, that's it.
That's too much?
That's what I need to get back to doing.
Please do it.
It's a lot when we talk about it, but when we do it and bring it into practice, it's not a lot.
Yeah. So now I have a lady who is coming from West Virginia. I believe Charlottesville. I don't know where it is. I think Virginia, somewhere in Virginia. So we'll be doing a 10 or 14-day cleansing. 10-day cleansing.
Wow.
Yeah. So we have a 10-day cleansing coming up for our client. And your date, did you text me your date?
Oh, I didn't finish the text.
So text me your dates. 20, 21, 22 or something.
23,
so we'll talk about your dates and I will see where I can put it together. And I will have a separate lot for you. Okay, in that time, maybe if I do, I will let you know about the cooking class because I really want you to start doing it now. No talking, now practical doing. Okay?
Yeah.
And if before you leave to the DC, that's your. Otherwise, you have to come from DC all the way. So, friends, I hope you enjoyed our skin disease concept in Ayurveda. Urticaria, that means Shita Pitta. That means Shita means kapha, Pitta means Pitta, and cold air. That all brings the imbalances on Vata, Pitta, Kapha. That's where the disease comes in. So you need to make sure what is the most important thing you need to make sure. Direct
cold air on
direct
skin.
Cold air on the skin is not good for us.
Not at all.
So now think about any place where you do not have an AC. Impossible.
I have to move
Impossible. Oh yeah. But
That's
just
not
do the
happening.
best.
Do the best.
Cotton
where
clothes,
we are.
light clothes, no black on the body. Okay? Black is going to absorb a lot of heat now because it's going to irritate your skin.
What about sunblock? I wear sunblock.
I never touch sunblock in my whole life.
Even with the skin condition, the sun is not harmful?
Okay, now that is a different topic. All different topic. But put your cotton clothes. See, this is my, now, hey guys, check it out, my clothes, okay? Now our weather is changing where I am. And I'm Ayurvedic doctor, Ayurvedic practitioner, Ayurvedic healer, blah, 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 blah. So, important thing is like you need to understand what you put on your body. And specifically, I have seen for the skin diseases, people have like 4 or 5 layers of clothes. Like specifically, they want to hide everything in the skin conditions. I have some doctors, some students, some clients that when I see them, this is open, everything is closed. And they have at least 2 to 3 layers of clothes on them
For their skin.
because they want to hide it. And then there's disease, I have seen their sufferings because skin is visible to the others. So people react differently, and then it brings a lot of psychological challenge, mental challenge, emotional challenge. My people cry, my clients cry. Can you imagine? They cry like a small babies, you know, because it's the stigma kind of thing, because people react and they tried everything. And that's why this is the structure of the clothes I would like you to use on the body when you have skin conditions. Cotton, clean, soft, and specifically I don't get heat very easily. I'm from a warm tropical place, but if you feel it's too hot, then stick with the bluish or the white color or the green color, rather than any other colors. Okay, because in massage room I work a lot, so I like heat with my, because I give a lot of energy. So I just need but if you suffer with the skin conditions, make sure you have proper clothing. Okay.
And it's okay to have my skin exposed.
Yeah, and then a lot of coconut water. I will suggest you now. Get a lot of coconut water. Coconut water, jackfruit. Coconut water is another good option. Buttermilk is an awesome option, but maybe I will teach you later on how to make the buttermilk. Yeah. Aloe vera. If you have aloe vera around you, you can mix that aloe vera in this my paste application, which I gave it to you. So you can apply, you can mix the aloe vera in this one also, like aloe vera gel. If you can find fresh or clean from Earth Fair or something, apply this into this one and you can apply it on your skin. Beautiful results. I don't have it, so I didn't give it.
I just buy one leaf of it and keep it.
Okay, perfect. Yes, here you go. You are getting it then. Okay. So urticaria, Shita Pitta, and this is a condition where we see a disharmony in all the doshas. Ayurveda sees this very prominently, how this Pitta is connected with the blood tissue in the body and the Pitta channels, the Pitta in the body and the blood tissue, how strongly they are interconnected with each other. And this is where you get the urticaria, and the proper ways of living for the urticaria is the key to behave and change for separately and efficiently for your physical health and mental health and emotional health, and very important social health. How about that? Social health is very important nowadays. Yes. And in the skin disease, I have this big challenge on my clients. Social problems.
Getting too close. Letting people touch you.
I have one doctor. He's a chiropractor, comes from the Lake Norman. And this doctor has a psoriasis. But the problem is, like, I did everything for him, like the way I do every of my clients. But one day he called me back after the cleansing Panchakarma program, and he said, Dr. Patki, it takes so much time to cook the food. It's so easy to go out and eat. And he said, I'm missing my 3 hours in the whole process of doing this. I said, I can't help you there. What I can help you is like giving you my knowledge and giving you my things. Or you can, because pickles, vinegars, dating, smoking, drinking, and then no food at all, no clean food. Everything is like a fast food kind of thing, Italian, and the way we eat. And I said, like, this is, your psoriasis is not going to calm down. Not at all. And you work whole day, like 8 to 5, something like that. Chiropractor. So
do your food preparation.
So food preparation.
When you buy your onions, chop them up. So when you go in the fridge, they're already chopped. You know, have your everything, your spices and herbs. So when you go in, it's not.
He loved Ayurveda so much, but following Ayurveda was not his cup of tea.
Yeah.
So that's what I said. You know.
For him.
Yeah.
We have meal service all the time.
He has to understand that. Yeah. So the skin diseases are a challenge because your relationship goes bad, your
self-esteem, your
concentration, your faith on self also goes down along with the skin diseases. So I really want you to think about this as a beginning of a challenge. So make sure that you follow good things, do good things, say no to your friends. If they're cooking for you fish and drinking and hey, come over, hang over, say I love you, or carry your stuff with you.
Exactly.
Carry your stuff
And
with you.
bring my
Or you
tea
can take
and
all of
whatever.
this in a purse and show it to them. Okay, now you are going to
This
pay
is what
for
I
my
gotta do.
services.
Yes.
Okay. Any other questions?
No.
You got the food?
I got the
You got the lifestyle?
I got it.
You got the herbs, you got the supplements, you got the applications, oils, paste, and everything.
Yes.
All right. So with this ghee, bedtime 2 drops into each nostril. 2 drops. 2 drops. You have a dropper at home? Yeah?
Yes. It's in something else.
Okay, that's perfectly fine.
Mesa oil.
2 drops of the ghee,
inside,
warm lukewarm ghee, bedtime, chin up, and apply it. Put it on your nose, inside the nose.
Okay.
You know
And I
how to
wanna
do
mix
it.
it first, though, right?
You
Because
don't
it's
have to.
separated. No.
Yeah, just lukewarm it.
Okay.
It will melt down very easily. Maybe small container in a hot water, double container, you know. You can do that. Any questions?
No.
All right. Good enough. Good enough to practice. I wish you good luck.
And
Do
to
it.
get coconut
This-
water, and you said coconut water.
Yeah, this is the one which will be coming on my website soon for purpose. This is the digestive thing which I am
Is that
preparing.
ginger and turmeric?
Yes. So very soon it will be uploaded. I'm just creating this digestive food. So it will be.
Do you have a recipe book? Did I get a? I know there's recipes.
There are recipes
there.
in this
Yeah.
book, but that is my next step. I need to do that. Maybe I need a good enough. It will come on my. Check out my website. In between, it will come under the products.
Okay.
Because this is a digestive, so I have to write down some of the medicinal effects of it, and then I will put it on the website. Okay. It's a whole process, and it's right here. Let me show you. Open up. Okay, good.
A little patience.
I know.
Sometimes
See,
it gets
I have
stuck.
4 open up. That's why it's not working. Okay, now let's see. So this is what is going to come very soon. So I wish this is a digestive, and this is exactly what I would like you to make it. And these are alkaline, and this has a lot of jaggery,
Okay.
a lot of ginger.
I like that.
Okay, and this is what the cleanser food I will be bringing it very soon.
Okay.
Okay, so this will be coming up
something
very soon.
Okay.
Amazing results. It's going to make the saliva, clean saliva, good
Activate
digestion,
the good enzymes.
good enzymes, stimulation, appetizing nature, appetizer. So this is a fenugreek. So a lot of things are herbal here, fennel and fenugreek and all of that. So it will be coming very soon. So you stay connected with it. Simple procedure, but not yet written the whole thing. So it will be coming soon. Okay?
Okay.
All right, dear? I'll put it very soon. I'm still working on some of the material for it. Okay, this is for you. Any other questions? So I wish you all the best. Thank you for coming here. This is Aruna Patki, a Ayurvedic doctor, a healer, a practitioner, a NCBTMB board certified TMB therapist. I'm here to share the wisdom of Ayurveda and yoga for your health and your wellness and your physical, your mental, your spiritual, and your emotional health and well-being approach here. So thank you once again. Take care. Namaste. Goodbye.